Microphone check. Cool, guys. So I'm on YouTube. I'm going to hop on Instagram, see if there's any final questions that people are asking on Instagram. Cool. Ask your questions, any questions that you have, prehab, rehab related, performance related, social media related, anything about me, PT school, feel free to ask away. Okay. All right, so I'm also live on Instagram now. So for those on Instagram, I'm going to be doing an Ask Me Anything Instagram Live. I got a few questions already from that questionnaire that I posted a little bit ago, but this is just going to be an Ask Me Anything Instagram Live. I'll start with the questions that I received maybe 4 or 5 hours ago, and then I'm going to go through any questions that you have here. I'm going to prioritize live questions, so feel free to ask your question here. First, I want to make sure the connection's good. Thumbs up if you can hear me. Same thing on YouTube. Thumbs up if you can hear me. Just want to see how the connection is over here. I know it's a little bit delayed, so I'll give it a few seconds. And then if you have any prehab, rehab related questions, social media, performance based, anything about our memberships, anything about what we're planning ahead. We've actually recently decreased hours at our jobs so that we could keep pushing with our content production, and we have some interesting plans in the next few weeks to few months. If you haven't subscribed to our newsletter, I would check it out just to stay up to date. We don't bombard you with stuff. It's just once a week. If you go on our website, you can a drop down menu or something should pop up if you want to subscribe. But again, thumbs up if you can hear me. Okay, looks like it's good. Cool. How many of you guys are international? Out of curiosity, what country are you guys from? Drop those down below. And I'm going to start off with answering questions. So, like I said, I'm prioritizing anything that I already had previously, just to start it off. But in the meantime, drop any questions below. So what is rotator cuffs? Rotator cuffs are 4 small muscles in the shoulder, basically one in the front and then 3 are on the top and the back. And actually, surprisingly, the one in the front, the subscapularis, is the strongest in the muscle that creates the most force out of the 4, which is not the one that's trained the most often. But the other ones are the supraspinatus, which is oftentimes the culprit of a lot of shoulder pain, infraspinatus, and the teres minor. So those are the 4 rotator cuff muscles, and they help stabilize the shoulder. Those muscles are very important to strengthen with shoulder health. So we have a ton of stuff on rotator cuff. Looks like we got some people from all over the world. Cool. Next, DTLG asks, good stretch to alleviate FAI. This is a tough one. First, you have to ask yourself, is stretching what I need? Actually, the last 2 Instagram lives ago, I posted something specifically on FAI, and I take you through a whole progression of things that you should focus on. Stretch in general, I would focus on hip flexion and hip internal rotation mobility. But again, if it's a bony change, you don't want to push too much into that bony change, because if this is your hip joint, it's a ball and socket, and you're butting the bone against the bone, you don't want to keep irritating the bones. That's actually going to create more osteophytes. So you want to make sure that it's more capsular or muscular if you're really pushing into those ranges of motion. RCKBOB asks, Rehab for bulging discs. I saw a study a little bit ago suggesting about 66% of disc herniations do reabsorb. So there's a good prognosis there. But there's also a lot of asymptomatic disc herniations. Funny story, I've seen people in the clinic that have no back pain that have came in with an MRI saying, hey, here's my MRI, treat me based off this. But the reality is there's a lot of asymptomatic issues, pathologies. It's not really too concerning, but if you are symptomatic with the disc herniation, you want to keep moving. You don't want to avoid all movement. It's a very complicated question. I'm trying to do a real quick Q&A, so I'm just going based off quick questions here. But we do have a low back pain app coming out. So if you're interested in more things back pain related, check out the link should be in our bio on our page. Okay, I already have a few questions on Instagram. I want to prioritize these. So let's see here. Give me what profession are you guys? I want to see. Are you guys PTs, chiros, average people that just have pain? What is it? What are you guys just looking for? Self rehab techniques, or are you guys mainly professionals here? Hey, how can you help with IT band pain? So IT band pain, a lot of times I'll focus on hip stability, and that in itself will help reduce stress and strain on the IT band. And actually, foam rolling the IT band, I don't really focus on too much, but focusing on maybe foam rolling around the area, like vastus lateralis, may have some attachment points on the IT band, which can help alleviate IT band pain. But I do a lot of stability work for that. Best treatment for supraspinatus tendinopathy. With tendinopathies, a lot of times I'll start with isometrics. Those are probably the only contractions that minimize or have almost no inflammatory response afterwards. So I'll start with isometrics, load it up as such, and then start getting people into concentric, eccentric, isotonic movements. Thoughts on BFR? I mean, I just taught a course on BFR last Saturday. Mike, Craig, and I all teach BFR courses along the West Coast. We love it. There's a huge use for it. From the rehab side of things, I think is where it shines the most, but it also has some implications in performance setting. Let me know if you have any specific questions with BFR. IT band pain, I just by Roll and Jack Ryan. Also info on BFR would be cool. It says my connection's bad. Let me know if you guys can still hear me and see me. IT band. So I just addressed IT band pain. Any info on BFR? Ask me any specific questions. There's tons of stuff with BFR. There's local changes that happen, systemic changes that happen, but really it's shown to help the most with strengthening with low loads. That's really where BFR shines. When you compare people that do low intensity exercises versus BFR with low intensity exercises, the group that does BFR with low intensity exercises has shown to improve significant strength as if they were doing high intensity exercises. With as little as 20 to 30% of your 1 rep max, you can get a benefit gains as similar to someone else that does maybe 70, 80% of the 1 rep max. I'm a right-handed pitcher. My right knee is extremely tender on my patella. How do I take care of that? I'm not exactly sure what your issue is. India, shout out to India. Let's see, Canada, nice. India again. Hi, coach, how are you? I have a question. I have osteoarthritis for a 16-year-old. I'm doing knee strengthening exercises, but when I do my seated straight knee, I have pain in my right hip. Any drills? This is from SimGrew. We have a post on Oscar Slaughter, actually. A lot of isometric knee strengthening exercises, like the quads, a lot of isometric quad work. I think BFR, actually, since you guys are talking about BFR, there's a good use for BFR in a patient like this. I'm not sure why specifically you have hip pain while doing that. Rehab for my left low back, my left rib sticking out, tension in my trap. I'm not sure. Like I said, with low back, we have an app coming out pretty soon here. So the link should be in bio. If not, check our website. It's coming out pretty soon, and I think that it can help a lot of people, especially if you don't have access to good quality healthcare. Do you see anyone with carpal tunnel, thoracic outlet syndrome by JT2101? Yeah, I mean, I wrote an article on thoracic outlet syndrome a little bit ago. I've seen people with carpal tunnel, TOS, yes, I've seen people with TOS also, JT2101. IT band pain, roll and Jack Ryan. I just kind of answered that with a lot of hip strengthening. I had partial knee replacement 2 years ago, and the pain is worsening by Sugar Dreams by DZ. I would recommend seeing a local physio. I'm not sure why the pain. 2 years, as long as you're doing your mobility work, strengthening work, you should be feeling better. Yang I can't pronounce this. What do you think about kinesio taping for low back pain? My primary use, I've taken a course on kinesio taping as well. My primary use for kinesio taping is really swelling management. If there's joint effusion or just swelling or inflammation in the area, I'll use kinesio tape. If not, I'll use it for a resistance cue sometimes. I'll try it out. Sometimes people just like the way it feels. It feels like they have some additional support. But for low back pain, have used it before, but it's definitely not my go-to. Personal trainer, I'm not sure what your question is. Cup beans grounds. Any tips on new students going into physical therapy school by Husa _ Jack. Oh, I see. You're saying personal trainer because I asked about professions. So any tips going into PT school? Basically, just keep an open mind. As long as you're not afraid of failure, you're going to allow yourself to absorb as much information as possible. Don't learn for the grades. Learn for the future patients that you're going to have and the lives that you're going to impact, and really try to soak that information and learn it for what it is and think about how you can apply it. Self-rehab techniques, specifically for what are you asking about, JT2101? Actually, you asked a question earlier about TOS. Oh, we have a post on this and multiple posts on this. We also have an article. Check out, go to Google Prehab Guys Thoracic Outlet Syndrome. You'll find some stuff. Sebastian Bohorkos. So shoulder socket depression while overhead range of motion. What about that specifically? Shoulder socket. Usually the problem is that the shoulder elevates excessively when you're elevating your shoulder. So I'm not sure what you specifically mean by that. Have advice for wrist injury. I'm doing bench. I'm doing no bench now. Well, it depends what the injury specifically is, but with bench pressing, a lot of times people will extend their wrist and put a lot of tension on the wrist. What you want to focus on is trying to keep the wrist a little more neutral. That way you can keep it a straight pillar, that's your arm, that is, versus allowing some of that shock to be absorbed with your wrist. And that's going to put a lot of stress and strain on there. Hello, Renee, entreated. Vikings or Game of Thrones. Honestly, I haven't watched either one. I know I'm the minority with that. Moderate arthritis of the hip, painful, but mobility good. What do you recommend? Big picture. Keep mobilizing it within your range of motion. Hip flexion and hip internal rotation are probably the two biggest things that you should continue to mobilize with. You can't afford any decrease in more mobility from what you already have. With arthritis, basically the joint starts degenerating. In addition to that, you want to stay strong. The more active strength you have with muscles, let's say muscles around the hip, the less the joint takes pressure itself. So you want to maximize your active stability being with the muscles versus passive stability. Because once you rely on passive structures like the cartilage or the joint itself, the cartilage is just going to continue to degenerate. Hey man, need advice on lower back pain? Check out the app that we're coming out with. We're already pushing out a lot of just free content, kind of like little samples. That in itself can be something you can utilize. And we've been posting one piece on low back pain each week. So every week you can go back and see something that has to do with low back. And start from a few weeks ago. We went from low level and we're starting to ramp it up to higher level exercises. Dangers of BFR. There's some relative contraindications. I would say absolute versus relative contraindications with BFR. There's a long list of it, and let me know if there's something specific that you're concerned with. JT2101. I just answered your question about the TOS stuff. Check out our website. Spinal stenosis. This is from Alex Kin 982. So with stenosis, I'm assuming this is low back, but you're extension sensitive, meaning when you extend the back, that's typically when you feel your discomfort. So with extension sensitive low back pain, you want to push them into the motions like that they prefer, which is flexion, and you want to allow them to extend from other places such as the hip. So a lot of times I'll focus on improving flexibility of the hip flexors, or maybe just teaching them motor control on how they can improve hip extension. But with specifically with this, it's the same idea with the hip idea I was talking about, where if you can stay strong, shock absorb with your muscles when you're walking, when you're exercising, you won't have to rely as much on the joints. But spinal stenosis is normal part of aging. It's basically internal wrinkles. The joints start degenerating as you age. It's not really that big of a deal. Just because someone's painful right now with spinal stenosis doesn't mean they need to be in a few weeks, few months. Hey man, SC coach from Czech Republic. Do you have any advice on chronic elbow tendinopathy? Could BFR be good? Thank you. So this is from Jiri Killinger. So you can use BFR definitely, especially if someone's painful with exercising. You want to strengthen the tendon, and so if loading, let's say 50% of someone's 1 rep max is painful, you put the BFR cuff on. You have them load 20 to 30% of their 1 rep max. That in itself is going to help improve strength. Similarly to if someone was to load it maybe 70 to 80% of their 1 rep max. So it can be helpful with that, but you do want to load the tendon. The histological changes that you get with loading heavy is what you want to also have someone go through once they're going through that continuum, especially when they're in that remodeling phase of tissue healing. But if they can't tolerate heavy loading, BFR would be good. How much time BFR shields should be used by Aldo Barza? So I recommend typically 30 minutes maximum at one given time, depending on your specific use for it. It really depends. I start people off sometimes with just one exercise and then have them work up to 30 minutes worth of exercising, which is usually at most 5 exercises. Cool. You guys do first rib mobility for TOS by David Reischuch. I do sometimes. That's not my go-to, but I do first rib. It's also because I'm mobilizing every tissue that's between me and the first rib as well. So I'm mobilizing the scalenes, I'm mobilizing the levator and upper trapezius, which are often symptomatic with patients that present with TOS. So I can give them maybe a little bit of window of opportunity to exercise a bit more with less pain. And advices on courses, leadership groups that help start your own PT business by Curtis Quattlebaum. So Curtis, I would check out Jared Carter is a go-to. Paul Goff is awesome. Aaron LeBauer is also great. Those are a couple people that I've looked into, and I've learned a lot with business in general. But I think they would be very helpful with you starting your own cash-based practice. Greg Todd is also very good. He'll fire you up. Any issues with BFR and not loading the tendon as much while the muscle is getting strong? D Lamfier 85. So when you use BFR, actually you get a huge spike of growth hormone, and it's shown actually some study I looked at had 70% higher amount of growth hormone release than high intensity exercising. So BFR plus low intensity versus high intensity had actually more with BFR plus low intensity. So growth hormone is primarily responsible for collagen synthesis, and that helps with tendons as well. So it's not to say that the tendon's not getting stronger, but the muscle itself is what's going to maximize its hypertrophy with BFR use. Blood clot from BFR by roll inject. So you've asked a few questions with contraindications. Blood clot, BFR in itself is not an independent risk factor for blood clots, but you want to screen people. I'd recommend you reading our article. I know you've had a few questions with BFR. Check out our article. We have some good stuff on there. There's 2 articles that we have specifically with BFR training. Check those out. And if you're local and within the USA, I would check out a course too. We go over a lot more details with that. I want to know shin splint prevention and treatment. There's a few different types of shin splints. Actually, funny enough, I'm building out a post on that, so stay tuned. All right, I'm gonna get off here pretty soon. There's a couple other questions that I had previously. Where are you from? I'm from Orange County originally. I live in Los Angeles right now. So Mike, Craig, and I are all in the Los Angeles area. Mike and I are in Santa Monica on the west side. Craig is in downtown. Cool. All right. What's going on, Amber? Cool. All right, guys. I'm gonna get off. I just wanted to do like a 10 to 20 minute live, and I kind of passed that point already. So, any other questions? Feel free to DM us. I'll keep note of the whatever questions you guys have, and we'll try to answer them next IG live. But we want to get more of these lives going in general, just because we get so many of the same questions, and I feel like it's very easy to address through these IG lives. All right, guys, thanks for tuning in.